So there's a book that I read by Dr. Howard Schubner. The book is called Unlearn Your Pain, and he has 6 F's that he describes that a lot of us do, or a lot of our patients do, in order to turn on that circuit and that loop of pain. For instance, fighting it. So just like anxiety, fighting it is not what you want to do. You want to allow it, not allow your pain, but not fighting it. Because once you fight, then you activate the sympathetic nervous system and you become more tense and you feel more pain. Fearing it, as part of anxiety, when you fear anxiety, you do everything to avoid as opposed to gravitating or going towards. So when you fear the symptoms, you're actually in a hyper-vigilant, very sensitive state of mind where you're fearing those symptoms. And then whatever those symptoms are is focusing on them. How do I get rid of them? I still have it. So a lot of times people with anxiety or sensations of anxiety will wake up in the morning and be like, oh my God, it's still there. Like thinking that it's just going to disappear. The morning is actually the roughest for a lot of people because in the morning, you're in a state of mind where your subconscious and then your conscious activates, and the routines that we do, grabbing the cell phone and doing all these things, all these you have to do work in life, start piling up, and boom, agitation, stressors, sensitized, and then right back to the same pattern. So again, focusing it. And then frustration, like being in that bewildered state, like, why is this happening to me? Why am I feeling this way? It's got to be something else. Maybe it's my hormones, Let me go see the endocrinologist. Let me see the ophthalmologist or optometrist for my eyes. Or why is this happening to me? Maybe I have a brain tumor. So those are the things, and being frustrated. Let's figure it out. Just let's look into it. Why am I having the symptoms? I got to get rid of it. Not looking at all the stressors and all the triggers and all the patterns, but looking at that box of symptoms of why you're feeling that way and trying to get rid of those symptoms. Remember, they're just symptoms. They're sensations. They're feelings. They're brought out through emotions. So if you're looking at that box of feelings and you become observer witness, you're going to be okay. Or you want to figure them out and set off that alarm and cause more anxiety. And the last one's fixing it. So again, try to fix it. Do you have a medication that's going to fix the problem? Do I need a medication for my migraines? I need a medication for my sleep. And then that's what triggers people with insomnia, is that when they can't fall asleep at night, they get into a pattern of fighting it and, focusing on it, looking at that bed and be like, oh my God, I got to go back to bed. I got to be up the next day. And, I need to sleep. I need to then maybe taking a supplement or medicine, and then that doesn't work. And what happens if I become addicted? And then taking the medicine, not taking the medicine. So fixing it, frustration, figuring out, fearing, and it all comes together. I like the way he put those together in F's, and you can use that for anxiety. You can use that for pain. But one of the things about anxiety is the alarm system. So again, we talked about the subconscious has protection, has patterns, and basically it's an alarm system. Now, do you want a system that is set off very easily, or do you want a system that's set off more efficiently? Talk to my patients with panic or feelings of anxiety, and the alarm system has gone off 6 or 7 times in the last 3 weeks, and there's no fire. They don't smell fire, but they hear the fire alarm and they run downstairs. They fall for it every single time, as opposed to holding, becoming an observer, witness, and starting to understand how to use your logical brain into understanding and changing your behaviors, and then even setting those habits so it's just automatic that you become an observer, witness of those sensations. So when I talk about the fire alarm system, is you want a sensitive system, but you want an efficient system. And you have to understand that you have 2 systems. You have the system in your brain that's causing alarm, meaning stressors and triggers and all those agitations. And then you have an alarm in your body that's producing the alarm. So again, recognize the symptoms in your body as just sensations and feelings. And when you interpret that as it's a feeling, then you gravitate towards it as a feeling, then you can start feeling better. As opposed to as running downstairs in panic that there's a fire and smelling smoke every single time. There's a saying that says, do what makes you afraid and you will have courage afterwards. So feel the fear, feel the sensations of the fear. That's how the brain learns, and that's how your amygdala learns that everything is safe. Because once the amygdala knows that everything is safe and secure, how it communicates to your cortex, then you become safe and it doesn't fire right away, or the alarm system doesn't go off right away. So, but when you're in a state of sensitized state where everything is sensitized, that's exactly what happens. It's easier to set off the alarm. So what does it mean to be sensitized? Well, loud sounds and people can sensitize you. The lights from the traffic can sensitize you. Remember, when it comes to anxiety, you don't have any safety and security. So what do a lot of my patients do is that they use safety people or safety objects for security. For instance, thank God, you were in the plane sitting next to me or in the elevator with me. Because if you were in the elevator with me, I don't know what I would have done. Then I wouldn't have survived. How is the person next to you in the elevator saved you? I mean, literally, like, it doesn't make sense. It's irrational, right? I see this when older people, they use canes. Some of them just have fear of falling and they just use the cane for safety and they lose the sense of confidence and they use the cane for balance, which is okay if medically they need it. It's taking away ownership and taking away the ability to control the symptoms yourself, which when you're in a defeated state, you're in this state where you can't make decisions. And when you're feeling in this anxious, sensitized state, you feel very vulnerable in that way. So, your confidence is off. You don't want to get into that state of mind. And you got to be able to recognize when you're in that state of mind. And you want to take control of that.